video is a brief overview of the 6 generations of cephalosporins, highlighting what I consider to be the more key features of each generation. To keep this video brief, these are the organisms I will be using to illustrate the activities of the different cephalosporins. Staph aureus is associated with skin and soft tissue infections. Strep pneumoniae, also known as pneumococcus, is associated with pneumonia and meningitis. For the gram-negatives, E. coli is associated with UTI and intra-abdominal infection, and Neisseria gonorrhea is associated with the STD gonorrhea. Pseudomonas is an important opportunistic organism which is inherently multi-drug resistant. For strains which have become drug resistant, I will use MRSA or MRSA, ESBL positive E. coli, and difficult to treat Pseudomonas aeruginosa. Cephalosporins are part of the beta-lactam antibiotics family, and the beta-lactam ring is responsible for the antimicrobial activity, and this binds to and deactivates PBPs, the enzymes involved in building bacterial cell walls. And microorganisms can defend themselves by producing enzymes which cleave beta-lactam rings, and these are the beta-lactamases. This is the penicillin nucleus, and this is the cephalosporin nucleus, and this is the beta-lactam ring. The key difference between the two is that the cephalosporin nucleus has a 6-member ring attached, and this enables cephalosporins to have 2 switchable side chains as opposed to the penicillins and the other beta-lactams, which only have 1 switchable side chain. So this has enabled quite a number of different cephalosporins with varying spectrums and pharmacokinetics to be produced over the years, with the latest generation coming out as recently as the 2020s. Cephalosporins tend to be used as more of an important but second-line alternative to penicillins, with just a small number of exceptions, the main one being the 3rd generation respiratory and anti-gonococcal ceftriaxone and cefotaxime. Again, to keep this video short, I will be using these cephalosporins only, and most of them from generations 3 onwards are IV hospital-only antibiotics. Let's start with the 1st generation. The representative I'm choosing is cefalexin. Structurally, cefalexin is closely related to the aminopenicillins, so cefalexin is pretty much almost identical to ampicillin. They both have 1 side chain, and the side chain is identical for both of them, so they only vary by their nucleus. It's a bit more nuanced than this, but essentially ampicillin doesn't have any Staph aureus activity, but cefalexin does, without requiring a beta-lactamase inhibitor. The cephalosporin nucleus enables cephalosporins to be resistant to penicillinases, which is a type of beta-lactamase. Cefalexin and other 1st-generation cephalosporins are primarily used for skin infections, and compared to the later generation of cephalosporins is relatively narrow spectrum, with only minimal activity against E. coli. The defining difference between the 1st-generation penicillins and the 1st-generation cephalosporins is that the penicillins don't have activity against Staph aureus, and the cephalosporins do. It's only until we get to some of the later generations of cephalosporins that we get loss of gram-positive activity, and I'll get into that later. The other important difference is that the cephalosporins lack activity against anaerobic organisms, and this applies to all the generations of cephalosporins. Next, for the 2nd-generation cephalosporins, the main representative is cefuroxime. Cefuroxime has 2 side chains, as well as an oxyamino group. This makes cefuroxime more resistant to beta-lactamases, resulting in improved activity against E. coli, and E. coli coverage is a defining feature of cefuroxime. So it is used 2nd line after amoxicillin clavulanic acid for E. coli infections, such as intra-abdominal infections. But as it doesn't have any anaerobic activity, it needs to be paired with metronidazole to provide additional anaerobic coverage. Cefuroxime retains activity against Staph aureus and is also used in skin and soft tissue infections. The third gens are a much larger group of cephalosporins and mostly IV only. So there are two types of third generation cephalosporins. So we have the respiratory and anti-gonococcal cephalosporins, which have activity against strep pneumoniae and Neisseria gonorrhea. And then we have the anti-pseudomonal cephalosporins. For the respiratory anti-gonococcal cephalosporins, we have ceftriaxone and cefotaxime, and these are the most clinically important cephalosporins. These are the only cephalosporins which have a first-line role, so namely in drug-resistant strep pneumoniae and first-line treatments for gonorrhea. They do also have Staph aureus and E. coli activity, but they're not used first-line for these indications. For the anti-pseudomonal cephalosporins, for this group, the main representative is ceftazidime. The key feature of ceftazidime is its anti-pseudomonal activity, but it does also have decent activity against the other gram-negatives as well. So this is to do with its right side chain having a Zwitter ion, which enables it to pass through the porins of Pseudomonas cell walls. So notably, the right side chain of ceftazidime stops it from working on gram-positives, even Staph aureus. Ceftazidime is reserved as a backup option for Pseudomonas and other gram-negatives, as it's associated with inducing resistance. You may have heard of the term extended-spectrum cephalosporins, which came out back when the second-generation CAFs came out, and this term refers specifically to the second and third-gen CAFs. As newer generations of cephalosporins continue to come out, this term is a little bit obsolete, but it is still retained in the term extended spectrum beta-lactamases, also known as ESBLs. So now we're at the fourth generation, and the main representative here is cefepime. Cefepime has the same left side chain as ceftriaxone and cefotaxime, and a similar right side chain as ceftazidime, where there's a Zwitter ion. So, cefepime has a broad spectrum of activity that is a combination of both, able to cover the gram-positives as well as the gram-negatives, including Pseudomonas, and can be described as a big gun antibiotic. It is reserved as a multi-purpose backup for when first-line options fail, and is also preferred to ceftazidime as an option for Pseudomonas. After the fourth generation, the fifth and sixth generations have much more elaborate side chains and novel mechanisms of action. The fifth generation cephalosporins are remarkable in that they feature a side chain which enables them to bind to the PBPs of MRSA, something that no other generation of cephalosporin nor any of the other beta-lactams are able to do. The sixth generation cephalosporins are the latest generation, which came out around the 2020s, and feature a radically novel mechanism of action where the right side chain is a siderophore. Siderophores are molecules produced by microorganisms to bind to iron, which are then drawn back into the organism via siderophore ion channels, and this is how bacteria take in iron for their nutritional requirements. The main representative in this group is cefiderocol, which has the same left side chain as ceftazidime, and the siderophore side chain on the right. This gives cefiderocol very potent activity against difficult-to-treat drug-resistant strains of Pseudomonas, and even ESBL-positive E. coli. But similar to ceftazidime, it has no activity against any gram-positives. So that's it for this video. Please note it's only meant to be a quick, beginner-friendly overview of the 6 generations of cephalosporins. Stay tuned if you want more in-depth videos on the cephalosporins. This video is for educational purposes only and should not be taken as medical advice. Thank you for watching.